Dr. Alejandro, welcome back to the podcast.
Rich, good to be back. How are you doing?
Hanging in there, sir. How about you?
Same, hanging in there and just trying to make the best of it. A little sad, our beach got shut down to 9:30 a.m., but hopefully it clears up this week and we go back to our normal beach time.
I was just about to ask you that. So did they change it to 9:30 due to the increase in cases recently?
Yes, everything we've been trying to avoid, which is community contact, has been established by the government. That means that they're not able to track down the epidemiological nexus and who got infected where. And that's brought up the next phase, which is community contact. In certain areas and specific high density population areas in San Jose. So they started to shut that down. It wasn't being controlled, and that's why they started the segment closings around the country, especially in San Jose, where you have orange and yellow areas. We're still in a yellow area, which has a little bit more freedom, but yes, beaches were restricted to 9:30. So hopefully that ends this week. That's trying to give the government and the Ministerio de Salud to buy them some time to kind of be able to start tracking back again the virus, where it is, how everybody got infected. Obviously, the amount of cases per day and hospitalizations and intensive care units have been receiving more patients, and they've been struggling a little bit.
Are the beds all full? Are the hospitals full, or is there still space? Are people worried about that?
They're almost full, and that's what they're worried about. The COVID hospital is starting to get into a critical point. I wasn't able to see the report from yesterday, the press conference. I know there's 7 deaths.
So
and
37 is the total?
37 is the total as of yesterday. But the important thing is, or the tragic but important thing that needs to make us aware, is that the cases have been steadily growing, and there's been more deaths in the last 2 weeks that anybody wanted, but also just increasing the amount of stress in the health system.
Okay, that makes sense. I want to ask you a question. It seems like the surge in cases really took off a couple of weeks ago. Last time we talked together, we were talking about the Nicaraguan border and opening up flights and all this type of stuff. Right after that, we saw a big surge in cases, in particular in the Nicoya area, and then it dropped a whole bunch. Can you kind of talk us through all that? Because we all got really worried when there were 2 cases in the general area and Nicoya shot up. We thought for sure it was coming in. And it doesn't seem like that happened in Nosara just yet. Can you kind of walk us through what's going on?
No, there were 2 confirmed cases that are not the Barco Quebrado cases. One of the cases was he went to Upala, then came back and had COVID, and then he was taken back to Upala. There were some not nice things around it, like some people threw rocks at his house, and that's
oh my gosh,
super sad. Like, instead of that, I think the community needs to join in and see what they can do to help, but it's weird times. Nicoya cases, they were having a difficult time tracking down all the cases, and people that were positive were still violating their health restriction. They were going out, they were going to the supermarket, they were going working, and that's what had the health officials concerned. They found a house in downtown Nicoya that had maybe 11 or 15 people living in there, and that's after the whole migration issue. The other issue that health authorities have found is what it's called cuarterias, or like small houses with a bunch of people living in them. And that's also why health ministry and migration and some other authorities were here in Nosara looking for those spaces to kind of, check everybody's migration status and kind of crack down on high density houses with a lot of people and not many health regulation and hygiene measures.
So is that why things have gotten better? Because it seems like Nicoya we were really scared. 2 weeks ago, 3 weeks ago?
Yeah.
And it's like it's gotten better. It's just because of the crackdown?
Yeah, they've been cracking down, and the way to do all of this would be to have an army of people just going out and talking to, like, you were a contact, so who you've been in contact with, and test them. But obviously they have a limited amount of people working there and all over the country and in any health system. Also, the massive tests have started in different areas of the country in the last 3 weeks, and Nicoya was one of them. So they're kind of trying to see where the higher concentration of cases and asymptomatic patients are, and that's going to give them a good percentage and a good idea of what's happening and how populations are behaving and the virus is behaving as well.
So what's next in your eyes? Like what's for Nosara, the Nosara area in particular? Like what's going to happen next?
Uncertainty. It depends on.
We have plenty of that, Alejandro.
I know, and everybody's trying to plan on different scenarios and different things, but I would be really conservative on doing that. Try to save up as much as possible, and be economic about your expenses. What's gonna happen is difficult to tell. I think this week is going to be critical for the next 2 weeks, right? Because we're 14 days behind, more or less. That's the incubation and the transmission time frame that they've set for COVID. So let's say we're 2 weeks behind. So some people that got infected 2 weeks ago might just be recovering by now. So what's going to happen, I think the government's going to evaluate the amount of cases and the amount of damage control they were able to do this week. And based on that, take measures. Airports, which is one of the main questions that I've been getting, and I'm guessing you've been getting as well.
Oh, yeah. That was actually my next question.
Airports, they're still set on August 1st. I wouldn't keep if I had to bet, I wouldn't bet on airports being open by August 1st. And if they do, I've heard from different sources around the government that there could be a restriction on countries where you can fly in from, the U.S. maybe being one of them. And I've also heard that the U.S. is not really happy with that scenario on having a restriction to fly anywhere, and they're trying to apply some pressure. This is all.
Yeah, I heard something similar from someone who said the exact same thing. So I sounds like we're heading that way, huh?
But this is all hallway gossip, right?
Yeah, all of it is. I think that's part of what is causing the stress for so many people is the uncertainty and not really knowing what's going to happen, or when can you leave the country? When can you come in? There's a lot of big decisions that need to be made.
Exactly.
And, it's tough.
There's something that has been pretty well. Mandatory masks started maybe 3 weeks ago, which was always a debate, but they're here. Now it's mandatory to go into certain places, and obviously a good recommendation to use them. It's going to, bring down the percentage of possibility of getting infected. But it's not as safe. What remains constant is social distancing, wash your hands, not touching your face. That's what remains constant. Masks, came in, and it's going to change certain scenarios. But those, 4 or 5 things that you've heard every day for the last 3 months remain the same. That's that we have.
I gotcha. So the core message is the same as all the other podcasts we've been doing. It's the same core message. Is there any changes that you want to know how the people listening to this are in our area? Is there any specific message you want to get out there?
I
mean,
definitely want
the same core message of mask, washing hands. Like, is there any new angle? Last time we talked, people were misbehaving in some ways, and you had some good guidance and messages for people. Do you have anything new that you want to relay to everybody?
Yes. Now the time is like we've been at it for 4 months almost. The mental strain has obviously increased, and it's a little more dense, and we're starting to feel and see the effects of this. So try to remain sane, talk to people, find
Sorry, I'm laughing when you said that.
Reach out, because it's difficult for, let's say, single people living by themselves. It's also difficult for parents with kids. It's difficult for everybody in all aspects of life. The uncertainty obviously, messes up with your head, not being able to plan, not being able to know, what's going to happen with money-wise, business-wise, family-wise, travel-wise. So reach out if you need to, try to find, online or through a support system, activities that kind of make you feel a little bit better, distract your mind from everything happening, restrict yourself on the amount of news and stuff that you're seeing, the amount of fake news and fake treatments and, what's happening all over. It's insanely high. There's a ton of misinformation out there. Try to find, again, like real sources, official sources, and, try to take it easy. The beach is open. Go run, go walk, go surfing, and let's see what happens.
Right. You mentioned some of the misinformation that's out there. What's some of the core misinformation items that you see?
The most recent one, it has to do with masks and people saying that they're, that they cannot breathe, that they're recirculating CO2 inside the mask. It's gonna intoxicate them. That is completely not true. The oxygen and CO2 particles are moving in and out of the mask. Surgeons have used masks for, surgeries last for 6 to 8 hours. Obviously, some Asian countries have been in the mask business for a while, and it is definitely not true. The molecules of oxygen and CO2 can go in and out, and you're not rebreathing CO2. And it's definitely going to protect. I do understand the uncomfortable factor, the maybe allergy factor, and the panic or the anxiety that it can create to wear a mask for long periods of time. But it is what it is. Like, if we ride the ambulance, we need to be with full protective gear and a mask for 3 to 4 hours, 4 hours and a half. And it definitely creates, it's really uncomfortable, it's hot. You want to scratch all your face, but I think it's manageable. If you need to wear your mask just to go into the supermarket and out, I don't think it's a big amount of time, and I think you're helping the supermarket staff feel safer, because they're going to be safer, you're going to be safer, and the rest of the people out there in the supermarket or public space are going to be safe as well.
So mask is a big one. I have another question for you. What's the substance that starts with an H? How do you pronounce that? The one that they were saying if you take it early, it helps offset the effects of COVID?
Hydrochloroquine.
hydrochloroquine. What's the latest on that?
No, hydrochloroquine has been ruled out. The rincimavir, I believe, is the name of the antiretroviral done in the States, which probably the States are gonna take most of the manufacturing, and plus the price goes from $1,500 to more than $3,000. It's gonna take a while for that to reach down here. There's been the management of patients intra hospital has changed a little. They haven't released at least a lot of like Costa Rican information. I know they're using a steroidal anti-inflammatory called dexamethasone. There's a bit of a controversy on using anticoagulants as well, but there's been a lot of evidence and a lot of evidence on a lot of kit cases of small blood clots in different parts of the body.
I just heard that on a podcast before I came in here. Is they're finding blood clots all throughout the body on the autopsies of the victims.
Yeah, exactly. So there's definitely no treatment for it. The people that have been stayed home, and I'm sure most people have heard, let's say, a testimony from somebody that had COVID, either through a family member or whatever webpage, Facebook, WhatsApp message. Some of them can be true, some of them not, but there's testimonies of people that, have used only, anti-flu medication. That whole ibuprofen or acetaminophen thing, it's also not true. And well, there's no real evidence of it.
All right, so that saga continues to unfold. As far as the vaccine goes, if you had to estimate, do you have any idea when do you think one might be available? Because my understanding is it takes about 4 years normally for a vaccine to get tested, run through the whole gamut, and I'm sure this one's being fast paced, but it seems like nothing but time is needed to really make it happen. So what should people expect?
I've read really good things about certain trials. I know there's a new trial started with 30,000 people. I believe it's in the States. Pfizer have already said a couple of things about it, but they need to make sure it's safe. So I think that the same timeline stays between a year and 2 months to a year to 8 months. Hopefully, the sooner the better, but they need to make sure it's really safe. And afterwards, end up with an extra eyeball or cancer or whatever.
So probably about half the time is what you're thinking. Exactly. It sounds like. Okay.
But
that makes sense.
There's a lot of interesting things happening. The way some European countries, France basically going back to normal, Spain trying to retake normal life, and how the cases go up and down. I think that's what we need to aim for. The country, I think it's everybody is pretty prepared for borders to open up and start seeing tourists. And I know everybody's anxious about it, but the government needs to be careful. And, every one of us needs to be careful. They open up the borders and people start to come in and they go into surfing Nosara and they're interested in, your services, and you end up getting COVID. And
well, that's the biggest fear, right? For all of us, is just trying to provide for your family or make a living, pay your bills, and then you end up getting sick and hurting everybody along the way. That's always been what's caused so much anxiety for so many of us. I have a question for you about Nicaragua and Costa Rica and the two different ways that the countries have approached it. Is there a chance that, since Nicaragua doesn't seem to really do much of anything, that it could get through there and it could get herd immunity much faster, and it actually might come out of this thing okay? Somebody argued that case to me last week, and I wanted to ask you.
It makes sense on a common sense scenario. The thing is, no one knows really about herd immunity. They are not, as much as I've read, they haven't been able to determine how much immunity you get after COVID. So maybe they're weirdly, a weird case that, they assume herd immunity faster than anybody else, or it just keeps happening, and the population keeps getting
and just continue circling. So right now we don't have any knowledge as to if the immunity is real or if that's so that's still up in the air. It sounds like.
Exactly. And
that's scary, man. It seems like we would hopefully know by now, but it sounds like we don't.
Yeah. And there's a couple of things. Make sure that you don't have stagnant water around your houses. There's been a few dengue cases. That's super easy.
Tell us all about that. Last time we talked, dengue was off to a really strong start this year. So fill us all in about all that.
But now, I mean, there's already some communities that have been or are starting to get hit by dengue. One of them is Nosara. We've already seen a couple of cases, and we know of a couple of cases around the Guiones area and Nosara area. So last thing you want to do is have also an outbreak of dengue. So make sure you don't have stagnant water around your house, your neighbor's house as much as possible, and wear bug spray. Last thing you want to do is
I'm sorry, I had a little time delay. I'm sorry. Finish that thought. I'm sorry, Alejandro.
Just to look around your house, look around your neighborhood, your neighbor's house, and make sure you have no stagnant water and that you're using bug spray. The Guiones area, all the sections close to the ocean, historically have been hit, and also the Nosara area, the little bit higher densely populated area, where there's a lot of people that have stuff in their yards, plant pots, and old tires, and the dog's water that's been stagnant for 5 to 7 days. Then you start breeding mosquitoes, and it just gets out because there's been cases of chikungunya and dengue.
I was just about to ask. So what's the latest on the chikungunya, dengue? Is swine flu back, or Ebola, or black plague, or anything else coming to get us? Like, god dang, man.
Yeah, man. I just try to focus on the positive. Hopefully, we'll have beaches open next week all day, and use your bug spray. Wash your hands. Jesus.
All right, I got it. Keep holding on tight and hurry up and wait is basically the assignment.
Yeah, avoid eating raw fish or raw chicken or undercooked pig. Jesus, try to be safe.
Hey, how's the new remodel at your clinic going?
Yeah, it's good. We have our COVID protocols in place. We have all of the protective gear, and every week we're learning more things and new things and training just to be prepared for this. Our reception now looks like a weird what would you say, like area.
I think it's cool, man. We all appreciate you doing that. What's your most common complaint, or what are most people coming in for right now? Like, what's the most common visit you're receiving?
It's been pretty all over the place, but I've definitely seen a spike on anxiety cases and people getting a little frustrated. We haven't seen that much flu, which is really good because obviously it can be
thank goodness.
Yeah, exactly. And less accidents, less stitches, but still people working at the houses, glasses being shattered and that sort of thing. We're still doing some stitches. But
so less fins to the head and less stingray visits?
Exactly. Even though there's been a lot of people coming into town, right?
It was crowded surfing the past couple of days, man. It's packed. I got ran over yesterday, actually, like just trucked. Nothing you can do. There's nowhere to go sometimes. I figured you guys might have a lot of stitches going on with all the San Jose folks here.
It's been up and down. It's been up and down, but unfortunately it's been pretty good. Like safe, I mean. And yeah, with the crew coming back, the San Jose, and people, you know, just hearing that Nosara has longer time on beef taxes and lower prices, obviously it reactivates the economy. Just make sure, because there's more people here, you're taking the necessary precautions. Our bubble has gotten a little bigger.
That makes sense. Well, you've been preaching to us about the Nexus for a long time, and it sounds like it's evolved to a new state. And now, well, like you said, there's nothing we can really do except for maintain the protocols and ride this thing out.
Exactly.
Your thoughts on schools for this year? Do you think that the kids are going to get sent back to school or no? Or what's your opinion on that?
That's a difficult one. Kids going back to school, there's been an increase in pediatric cases, right? I believe the last number I heard from this week that it's there's about 100 active pediatric cases.
Okay.
Fortunately, and there were 2 cases in the intensive care unit, which obviously freaks out people, and you know, it creates a little of higher level of awareness and alert. So schools are going to remain closed until September, I believe. September or August.
I thought it was early September.
Yeah,
I could be wrong though.
Yeah, the public system. The private system has been finding ways and having their protocols ready for, you know, if they're able to open. Every sector has to comply with Ministerio de Salud protocols and restrictions, and what they're looking for is that people are going to follow all the hygiene measures. They're going to wear their masks, their social distancing as much as possible. So I think there's some time still for them to kind of set this up properly, and also see the evolution as a country on where it's going.
I gotcha. Do you expect us to continue the ups and downs of this thing? Because like when we started talking, New York was just about to get bad, and then it did get really bad, and now it's not so bad. Now Florida's bad, Texas is bad, and just around the states. European countries seem like they've held it together for the most part. Italy, when we first started talking, was horrible. France, I think, was doing pretty bad too. But so it seems like some places have really turned it around. Do you attribute that to mask and just implementing your basic core message of being sanitary?
And also epidemiological models predict something like this, just ups and downs of how it's going to go. Population.
So Nicoya was kind of the same thing, because it was nothing, then it took off and went crazy, and now it's back down again, and so that's just going to continue to do that for a while.
Yeah, and what's remained constant is highly densely populated areas like San Jose, Desamparados, Pavas, Alajuelita, and those are the places where it could have the highest amount of cases, the most amount of cases, and also that, you know, would be like the biggest spreaders all around.
Yeah.
So I think
we had some construction crews who were going back to really crowded areas and then coming back here, and we were really concerned about that. Is that still in play, or do you think that your message has gotten out to the builders and people are listening?
I hope I hope they've started to restrict in whatever way they can. Or at least make sure that they're taking the proper measures, because that can really affect the community.
Yeah, it could. It also could really hurt if the construction jobs shut down. That would be horrible for so many reasons, between crime and all kinds of stuff. So I'm not rooting for that. Anything bad to happen to those jobs. I'm glad that those folks are able to work, but I and you and everyone else are obviously very concerned when you're in the community and you have a lot of people around in a dense area. It seems like it can spread really fast. Yeah.
Let's see. I think I'm still on the way they've been doing things. Government, I think, that we've had good leadership. Hopefully it remains that way. There's things that could have been done different that they probably will try to do different. Uh, People, and I recommend, just be measured, take care of yourselves. It's going to be difficult to plan ahead, try to mentally healthy, and we need to write it all. You need to write this all together.
You're right. It sucks, man. I'm really tired of this COVID thing.
Yeah, me too, Rich. Me too.
So, Alejandro, do you think it's a good idea for people to run out and get their blood tested? Is that a good idea right now, or will that just create more anxiety?
It's always a good idea to know your blood type. I don't think it's a necessary thing you need to do now. Anyways, if anything were to happen, that's a really basic test that they do in any trauma or emergency room. On the other hand, a lot of people, there was a shortage at the blood bank in San Jose, and a lot of people were, asking me, and we wanted to bring the blood bank here to do a blood drive. It's really hard. They're super busy, and they cannot take the time to come into a new scenario and just start to draw blood. The process of drawing blood and saving blood for the blood bank is not as easy as just, put it in bags and take it back to the hospital. And amount of staff.
Okay.
So I don't think that's going to happen. It was also really difficult to finally get a hold of him. And a few years ago with Jamie McAlpin, we tried to do a blood drive, and they just had so many restrictions, and the distance from Nosara to Nicoya Hospital or the real blood bank in San Jose, they were not so thrilled about it.
I got you. Well, good thought, though, and shout out to everyone who volunteered and got behind the initiative. But once again, Nosara's logistics just don't add up.
Yeah. And if you go to San Jose, if you go to San Jose and really want to donate, you can do that. The thing with foreigners living here in Costa Rica is that they have different blood types than that we have here, which is we're predominantly O blood type, but it's been registered that North Americans and different European populations are more A's and B's or ABs. Just if people want to go down to San Jose and really donate, reach out and we'll help you find a way.
Okay, cool. What about vitamin D and zinc? Do you recommend people start taking those supplements or vitamins or get their hands on them somehow?
I recommend people have a healthy diet. If you feel better taking vitamin supplements, it's always good, but it's not something that it's required or necessary if you have a healthy diet and a healthy
I get
lifestyle.
So running out, getting a blood test, finding out what you're deficient on, and all that type of stuff, probably not a good idea for everyone to go do, is what you're saying.
Exactly. Not necessary COVID related. Okay.
That's cool. I think we talked about most everything. We covered dengue, all the crazy stuff out there, all the uncertainty. You're telling us to stay mentally sane even though it's tough. Let me ask you this. Hey, what are you doing for fun? How are you staying sane, doctor?
I've been trying to go as much water as possible.
Okay.
I had an ear infection that it's been messing up my surf time. And I've actually been working on a couple of medical projects. So that's getting really easy and sane. And the kids are just fun to be around with, and just trying to take it easy.
I got you. Well, we have the beach at least till 9:30, and perhaps that'll open back up. Is that what you're saying?
Exactly. Hopefully by the end of this week, it's back up.
Okay. All right. As always, we really appreciate you coming on. How about we do another one of these in Spanish tomorrow or the next day? That's a go.
Yeah. I will send in Bati, and Bati. Hector, our paramedic, has been doing a lot of research on COVID and up to date.
Okay,
Yeah.
that'll save us a lot of work on the subtitles of this. So we'll just launch a Spanish one for anyone out there. Yeah, thank you for everything.
Thank you, guys.
It helps to hear your voice. It helps a lot of people. I always get messages and phone calls, and then about a week or two ago, the messages and phone calls started coming again. Hey, can you get Dr. Alejandro back on? And
Well,
you're doing a great job of being a leader for the community, and I want to thank you for that.
if people need to reach out, use our social media or contact any of the staff at the clinic, which everybody knows most of them personally. Don't hesitate to just reach out. We're doing a lot of telemedicine with psychologists. That's also a mindfulness specialist, and a lot of our specialists are willing to do telemedicine and help out. There's a bunch coming in as well, so people don't have to leave Nosara. But don't hesitate to reach out and just, we have no judgment on the questions you do.
Thanks, man. That's very cool. Last question. Can people go get tested yet in Costa Rica easily?
Yes, they can. San Jose, Huacas, Liberia, they're trying to recommend that people get tested, because I know more people want to get tested for immunoglobulins because everybody had COVID in November or December last year, because they had the horrible flu, etc., etc. The immunoglobulins is still tricky. The COVID test, they can definitely do in 2 or 3 different spots, but they're still recommending that you get tested on if you need to, if you were in direct contact, not just a random thing that you want to go for. Plus, the test is horrible. They need to stick a huge Q-tip inside your nose that reaches to the back part and draw blood and take it out. And it's not nice. It's not a nice test. Test. It's not as easy as going and getting a swab on the side or getting blood work. It's a difficult test.
I got you. I heard there's some new ones out there now, but of course it's going to take a little while to get on here.
Exactly.
I understand. That makes sense. As always, Doctor, thank you so much. We appreciate you, and hopefully we're not talking too soon about this.
Hopefully. Take care, guys.
Thanks
for the platform. Thanks for the time. At the end, Rich, good to see you guys.
You got it, buddy. See ya.
Take care.